This last module will focus on research ethics and grant application. Let's look at research ethics. Why research ethics? This stems from the World War II German human experimentation, whereby doctors, in the name of science and research, experimented on human civilians as well as prisoners of war and did horrific experimentations on these people. As a result of that, in 1947, the doctors were put on trial. And because of that, Nuremberg Code 1947 was formed, whereby it outlines research ethics principles on human experimentation. In 1948, the Declarations of Geneva stated what the roles of physicians should be on their patients in medicine. Finally, in 1964, the Declarations of Helsinki, based on the Nuremberg Code and Declarations of Geneva, outlines the principles of research on human research. Let me now outline the Declarations of Helsinki. There are several principles of Declarations of Helsinki, but let me focus on 6 main principles. Firstly, autonomy. The patient has the right to refuse or choose the treatment. As a medical researcher, we should respect the right of the patients to choose whether or not to participate in the research. Secondly, beneficence. A practitioner should act in the best interest of the patient. During the research process, if in doubt, we should always consider this point, whereby are we doing this research in the best interest of the patient? If not, then we should not be conducting the research. Non-maleficence, this is self-explanatory. First, do no harm to the participant. Fourthly, justice. It concerns the distributions of scarce health resources and the decisions of who gets what treatment. This involves the principles of fairness and equality. This is particularly important in populations which are marginalized, for example, people in the rural setting. Dignity. The participant should be respected. For example, during the course of the research, we should respect the privacy of the patients. For example, we need to examine the patient. It should be in a private and confidential setting. Lastly, truthfulness and honesty. This involves the concept of informed consent. We should explain to the participants exactly what procedure they'll be undergoing. In this way, they can imagine what they will be going through, and in which case they will make a decision whether or not to participate in the research. Next, it's important that you know about the ethics committee. In some situations, it's called the Institutional Review Board. An ethics committee is an independent body of scientific professionals and non-scientific members. It reviews, approves, and provides continuing review of human research or trial protocols, amendments of any materials, methods and materials to be used in obtaining and documenting consent of the trial subjects. You may be asked to stand before the ethics committee to explain your research protocol and also justify some of the issues that may be raised by the ethics committee. It consists of several members, usually 5 to 12 members, from varying backgrounds, gender, and speciality. It reflects local community, someone who has expertise in ethics, sufficiently qualified to assess research, a member with legal background, at least one medical specialist, at least one with no relationship with the institution, at least one lay member, and all of them should have no conflict of interest. What are those studies that require ethics committee approval? All clinical trials involving human subjects, whether patients or healthy volunteers. All studies requiring additional procedures on human subjects. All questionnaire studies involving patients, participants, or their relatives. All those online surveys, medical educations, for example, medical students or postgraduate students, should also undergo ethics approval. There are certain special groups that require special attention, and these are research with children, prisoners, and adults who are not competent to give consent, for example, patients with dementia or those with mental disabilities. Secondly, research involving the use of genetic materials and stem cells. And finally, any research that may impose an undue disadvantage upon participants should require special attention from the ethics committee. What should you do when you apply for ethics? These are some of the things that you should bear in mind when applying for ethics approval. You should complete the research ethics application form, which usually include who are the research team, their CV, summary of the proposed study, signature from the relevant authorities. You should attach the following documents, which include the proposal, participant information sheets, consent form, research instruments such as the questionnaire or the interview guide, and follow the guideline provided your medical ethics committee. Let me elaborate more about the participant information sheets. The participant information sheet should be written in a clear and simple language for general public. It should be in a way that most people could understand without any scientific background. Participant information sheet should include the following items. What is the purpose of the study? Why have I been invited? Do I have to take part? What type of study is this? What will happen to me if I take part? Are there any expenses or payment? What will I have to do during the study? What is the procedure that's being tested? What are the possible disadvantages or risks? What are the possible benefits of participating in this study? What happens when the research study stops? Will I continue to get the treatment? What if there is a problem? Who should I talk to? Will my taking part in the study be kept confidential? Is the purpose of the study educational? What will happen if I don't want to carry on with this study during this research? Next, where can you seek ethics approval? This depends on your local setting. In most cases, academic institutions, healthcare institutions such as a hospital, or from health authorities or the Ministry of Health. Finally, I would just like to remind everybody that medical research is subject to ethical standards that promote and ensure respect for all human subjects and protect their health and rights. Research ethics is an important part of the research process. It is important that you familiarize yourself with the Declaration of Helsinki and abide by the principles throughout the research process. If in doubt, please seek help from the Research Ethics Committee of your institution. Thank you.